In response to COVID-19, PSP is offering telefitness to Canadian Armed Forces members. By using social media platforms, the telefitness classes tailored to Canadian Armed Forces personnel became accessible to all. Prior to participating in this session and to make an informed decision on whether you should seek advice from a qualified exercise professional or healthcare provider, consult the Get Active questionnaire of the Canadian Society of Exercise Physiology and its reference document.
Hi there, I'm Amy, a fitness instructor out of Petawawa. In my video today, I'll be expanding on Petawawa's last core video, which covered core stability from the floor. We'll progress by standing and performing anti-lateral and anti-rotation exercises. Before we get started on our warm-up and go over our core exercises today, I'd like to touch on a couple points that I find relevant when it comes to training, and core training specifically. This is a really unique situation because I'm not there to coach and correct you. It can pose a challenge because people don't always understand what's going on in their body or what their body should be doing. And I don't know what your training history and fitness level is. You can always video yourself, but unless you have a solid understanding of what something is supposed to look like, it won't necessarily mean you can make a change. Although it's not ideal, I think this is a great opportunity for us to simplify things, get back to basics, and add an educational component that can help you understand what you should be doing and when. Learning how to self-assess, tune into your body, and then choose exercises, progressions, and load based on your fitness level and ability level, and being honest about it is one of the best ways that we can move forward safely and effectively.
One of my goals as a coach is to encourage you to move well and stay healthy long term. Prioritizing your back health is a great way to facilitate this. Having a basic understanding of the anatomy of the spine and the role it plays in functional movement will help you to prioritize training methods that keep you pain-free for life. The spine is comprised of a series of stacking bones called vertebrae, which are separated by cartilage called discs. The three main portions of the spine we'll discuss today are the cervical, which is essentially the neck. Its role is to stabilize the head. Directly below that is the thoracic spine, or T-spine as it's commonly referred to. That makes up your upper back region. Its role is to create mobility. Below that is your low back, which is considered the lumbar spine. Its role is stability. The natural S-curve created by the spine in this side view is what we should be striving to keep at all times. To maintain that proper alignment, we need to train the musculature surrounding the spine accordingly. We need adequate stability through the lumbar spine, and it's essential to create that long-term back health. Mobility in the T-spine and hips will also help to support this. The spine is capable of flexion, extension, lateral movement, and rotation. But every time we move our spine through these ranges, or take it out of a neutral alignment, or put it under load, the discs of the back receive uneven pressure as the vertebrae come together. This pressure over time can cause damage to the discs and compound, leading to low back pain. The spinal discs are comprised of a gel-like middle, which is surrounded by multiple rings of a fibrous cartilage. The discs don't adapt to movement and loading the same way other parts of your body do. With progressive training and rest, your muscles, ligaments, tendons, and bones will all regenerate to become stronger. Unfortunately, the discs don't regenerate in the same way. Once the fibers of the discs are worn, your body will not repair them. It's more of a maladaptation versus an adaptation. This is why what we do in and out of the gym is so important. Using the right exercises with proper form and being hyper-aware of your alignment will help to protect your discs from degeneration. Training should enhance lumbar stability and support endurance in your postural muscles. Certain exercises are more risky than others for the spine. Dr. Stuart McGill from the University of Waterloo has done some extensive studies on the spine. His research has shown that certain movements and improper alignment under load puts enough force to expedite the degeneration of the discs. Exercises that promote excessive flexion in the spine, like sit-ups, loaded side bends, or toes to bar, should be replaced with exercises that put less newtons of force on the discs and further enhance lumbar stability. Exercises like deadlifts that are loaded are a bit more risky and should be done with loads or equipment that allow the spine to stay aligned and to protect the discs. As the outer layer of the disc wears, the middle can begin to push out, putting pressure on the nerve and causing acute or chronic pain. To achieve and maintain proper posture, a strong neuromuscular connection and body awareness is very important. The CNS, or central nervous system, is the control center for the body. It's responsible for contracting your muscles and creating movement. A strong connection with the brain and the core musculature will ensure proper spinal alignment is achieved and can be maintained, even when challenged by outside forces such as movement, velocity, or load. Visually, proper alignment should create balance between all of our joints, both from the front and from the side. Postural faults are quite common and should be corrected as soon as they're identified. When neutral alignment is compromised, we know that undue stress is put on the discs. This dysfunction can occur in both the upper and lower spinal segments and is usually caused by muscular imbalance and inadequate body awareness. Excessive rounding in the T-spine is called kyphosis. It's usually caused by tight chest and trap muscles and underactive neck and upper back muscles. This creates an undesirable imbalance referred to as upper cross syndrome and can be compounded by spending a lot of time looking down at your phone or working on a computer in front of your body. Mobilizing the shoulders and training the upper back muscles regularly can help to correct it. Also, being aware of your posture at all times and spending as much time in proper alignment as you can will help to strengthen the connection to the CNS and train the muscles of your core to be resilient, making it easier to maintain proper alignment and posture over time. An excessive curvature in the lumbar spine is referred to as lordosis. It's generally caused by having weak abdominal and glute muscles combined with tight and overactive hip and lower back muscles. This lower cross imbalance can be corrected by mobilizing the T-spine and the hips and ensuring proper function of the lumbopelvic hip complex. This is comprised of all of the tissue that connects the pelvis to the torso and the pelvis to the legs. To create functional movement and power, force is generated in the hips and then transferred through the torso. If the glutes are underactive, the lower back will try to take over. Because this is not its role, it needs to remain stiff, or function will be compromised, and the risk of injury will be increased. The ability to take full and complete breaths is essential for spinal stability. It's also a common area of dysfunction. Fortunately, the muscles involved in breathing are like any other muscle in your body, and trainable. With some effort, over time, you can see positive improvements. People who only breathe through the chest tend to have less function in their breathing muscles. A proper breath will pull the air all the way down to the lower abdominals and fill the lungs completely, allowing a 360-degree expansion. This action activates the muscles in the pelvic floor, the deep lower back muscles, the abdominals, and the diaphragm. The co-contraction of all these muscles will create intra-abdominal pressure. In every breath, you should be able to see your abdominals expand forward and feel the pressure through your pelvic floor, side body, and into the lower back. When creating intra-abdominal pressure, I love the analogy of filling a canister. With the diaphragm pushing down, acting like a piston, the outward pressure is created that helps stabilize the spine. To create this intra-abdominal pressure, a strong central nervous system connection is important. Being able to tune in and feel the expansion through the whole trunk is essential to improving the function of breath. Once this connection is solidified, your ability to breathe properly becomes second nature. It will adapt quickly and effortlessly as you progress through your training. There are so many positive adaptations that functional breathing can provide, including some profound effects on your mental and physical health. To address dysfunction, Add breathing to your training regime or just learn more, I recommend this free breathing app to guide your practice. To create and maintain proper alignment from a standing position, I'd like to go over a simple checklist that you can easily utilize to strengthen your brain-to-body connection and train your postural muscles. I encourage you to use this bracing sequence when you're preparing for a heavy lift or when you're lifting or moving with awkward weight.
Begin standing with your feet shoulder-width apart. If you have a yoga mat, you can stand on that. If not, just pretend you're standing on a mat. We'll root down to the floor with the feet, evenly distributing the weight on the 4 outer points. Pretend to rip the mat apart with your feet. That should turn on all the muscles of the legs. Actively engage your glutes, trying to make your butt cheeks hard like a rock. Pretend someone's going to punch you in the belly and engage your abdominals heavily. Pull your rib cage down. Pull the shoulders back and down, like you're placing your shoulder blades in your back pockets. You can gently squeeze the fists to add some activation through the arms. And then the last thing we'll do is just gently pull the chin back so that the ear aligns with the shoulder. From the side, we should be creating that perfect line from the foot through to the knee, all the way through the hip, shoulder, and then finally through the head. The amount of tension you can create here will help you to stabilize the spine under load and train the postural muscles at any point throughout the day.
We'll begin our warm-up with cat-cow, flexing and extending to traction the spine. We'll also explore some movement through the side body in this position. Then we'll change to wrist mobility, getting some stretch through our forearms to help prepare us to lift and carry load. Then we'll use a T-spine rotation to help unlock the upper back, finishing with an instability exercise called bird dog to activate the core. Begin in tabletop. Inhale to cow, drawing the tailbone towards the ceiling, pressing the belly down, and opening the chest while you gaze forward. Exhale to cat, tucking the tailbone, spreading the shoulder blades and dropping the head. Inhale back to cow, leading with the tailbone, belly down, chest wide, gaze forward. Exhale cat, tailbone tucks, spread the shoulder blades, drop the head. Now inhale, leading with the head, gaze forward, press the chest forward, belly down, and tailbone up. Exhale, drop the head, spread the shoulder blades, and tuck the tailbone. Inhale, gaze up, belly down, tailbone up. Reset in tabletop, and we'll move to working our breath to the side body. Inhale middle, and exhale, press out to the side with your torso. Inhale back to middle, and exhale all the way to the opposite side. Keep your limbs in alignment. Hands directly under shoulders and knees directly under hips. All of the movement with the breath comes through the side of your body, feeling length through the intercostal muscles, or the muscles that are in between your ribs, and your oblique muscles, which run alongside your abdominals. We'll repeat a few more times each side. Resetting in tabletop. Mobilizing the wrists now, we'll draw our torso forward to give a little bit of resistance and feeling that stretch through the forearms. After 3 times, we'll do a gentle circle clockwise, resetting in the middle, and then a gentle circle counterclockwise. Change the position of your hands so that your fingertips face the knees, and now draw the hips back so that we're getting some length through the forearms in the opposite direction. 3 times here, and then we'll do 1 clockwise circle, exploring your range, and 1 counterclockwise circle. We'll reset back in tabletop and move into our T-spine. Right hand goes behind the right ear. We're going to open up to stack the shoulders, then reach down to tap our right elbow to left. Open up, stack the shoulders, and we come down, tap the elbows. You can inhale on the open and exhale as you tap down. Reset, left side. Left hand behind the ear, Open, stack the shoulders. Exhale, tap. Inhale, stack, keeping that chest open, and exhale, tap. Last time, inhale, open, and exhale, tap, reset in tabletop. Inhale, moving to bird dog, right arm extends, left leg, hips stay in alignment. We'll reset in the middle, and then inhale while we extend opposite limbs. Try to avoid any deviation through the torso. Keeping your core tight, we counterbalance as we challenge unilateral stability. One more time, each side. Engage the glute. The heel only needs to go high enough to align with that butt cheek. We'll reset middle. Next, we'll challenge our lower body stability and upper body mobility simultaneously. Utilizing the world's greatest stretch, we'll activate the glutes and open the hips while we explore our range of motion through the upper back. Begin in high plank. Shift your weight back and step through with your right foot so it lands outside the right hand. Drop your left knee to the floor and press your pelvis forward. Engage your glute and reach up with your right and then left arm, slightly pulling back with the shoulders. Bring your hands in front and open away from the knee, resetting in the middle, and then opening towards the knee, aiming to keep your hips pointed forward and exploring your range of motion through your upper back. Come back to high plank, and then move through on the opposite side. Weight shifts back, left leg comes forward, right knee to the floor. Pelvis forward, glute engages, reaching up and slightly back. Reset middle, reach away from the knee. Reset, reach towards the knee. Reset, and we'll repeat on the first side, trying to get a little bit further on that step through to explore the range through the hips. Pressing the pelvis forward a bit more aggressively and engaging that glute heavily. Shoulders can come further back this time. On our rotation, active engagement through the glute to protect the low back and exploring all the range that you can find through the upper back. Come back to high plank and repeat second time, second side. Again, exploring a further range of motion through the hip flexor, heavy engagement through the glute, and finding our full range of motion through the upper back, while all of the musculature in the pelvic region is engaged. We'll repeat one more time on each side, finding our fullest range and most aggressive engagement through the glute. Arms come forward, reach away, reset middle, reach towards the knee. Come back to high plank, and last time, step through all the way to the outside of that hand. Consciously press the pelvis forward and pull the shoulders back. Reset middle, reach away, reach towards the knee, coming through with the right leg meeting the left. The last warm-up exercise will be the most complex. You'll challenge your unilateral balance and stability through your lower body and your core muscles while you move from a knee drive to Romanian deadlift in one flowing motion. If necessary, you can touch your foot down in between for balance, but we look to get our hips aligned just like headlights on a car, both pointed towards the floor. Don't rush through and make sure you're breathing. Engage your bracing sequence. Shift your weight to your right foot and draw the left knee up so it aligns with the hip. Flex the foot and maintain a soft bend through your right knee. Drive your hips back, sweeping your left foot all the way through towards the wall behind you. Allow your torso to come parallel to the floor and dial your left hip to align with the right. Sweep through to come all the way back to your starting position. Reset, aligning your hips, And then once again, drive back with your hips, sweeping the left leg through, trying to get the heel a little bit further up towards the ceiling and the leg a little longer, still aligning the hips by driving the left down towards the floor to align with the right. Sweep through to reset, and one last time, nice and slow, sweeping all the way through, explore your fullest range of motion here. Bend the right knee and engage the hamstring and all of the muscles through the lumbar pelvic hip region. Come back to middle, and we'll switch to the other side. Shift to the left, drive right knee up, flex the foot, moving back with the hips, soft knee on the left side, torso parallel to the floor, right hip dialed down. Sweep through, touching the floor if it's necessary, back to start. Drive the hips back, soft knee, engaged hamstring and glute. Align the hips. Get a little further if you can. Sweeping through, reset at the top. Last time on this side. Try to get a little bit further. We're looking for a heavy engagement through the left leg. Heel towards the ceiling, leg long, torso parallel.
For our first anti-lateral exercise, we'll perform a loaded leg lift. You can use a farmer hold with kettlebells, dumbbells, or jerry cans, or switch to a pack to do a zercher hold or an overhead hold. Whatever load you decide to use, ensure that you're lifting it with proper form. From your loaded position, we're going to change our balance by lifting one leg off the floor. Your goal is going to be to keep level hips and work hard through your core and all through the lumbopelvic hip complex to maintain perfect alignment and stability, even though we're only balanced on one leg. We'll begin with our working leg being the left. So shift the weight to the left leg and lift your right leg so that your knee is in line with the hip and the foot is slightly flexed. Resist the urge to drop to the side. Shoulders can come back and down so we have that perfect alignment from the top to the bottom of the spine and a very heavy engagement through the core to resist this lateral movement. We'll switch to the other side, shift the weight to the right, lift so the left knee is in alignment with the hip, and again, we're resisting any urge to drop to the side. You can choose to do this for time or breaths, and then based on your current fitness level and your ability, you decide how long and how many reps and sets you do it. If you want to switch to a zercher hold, you can use the pack and hold it out in front of you. This lever lengthening makes it a little bit more difficult, and depending on the load of your pack, you can start to challenge yourself more. Again, before you lift, we shift to the working leg. You can consciously counterbalance or press down with the leg that's about to come off the floor so that we have a conscious stabilization and counterbalance. If you want to go overhead, it can add extra challenge as our lever lengthens even further. Anytime we're holding anything over the head, you need to make sure that the arms are stacked joint on joint. So shoulders are back and down, wrist, elbows, and shoulders are in alignment, and then from there, our shoulders, hips, and feet are aligned. We'll shift to the working leg, and then slowly lift, making sure that we're not dropping to the side. In our last anti-lateral exercise, we'll perform a suitcase carry. You can use various loads for this, just ensure you're only loaded on one side, because that's what makes it a suitcase carry. Anytime you're lifting off the floor one-sided, consciously engage the muscles on the opposite side of the load to ensure that there's not too much pressure on one side of the back versus the other, or any rotation happens.
From your standing position, engage the opposite side of the body to the load. The load's going to want to pull you laterally, and you're going to work heavy through the muscles on the opposite side of the body to maintain this alignment. From there, to make it more difficult, we'll move forward. Use small steps to maintain alignment with the hips. The larger the step, the more pressure we put on either side of the spine. Tiny steps, core tight, braced the whole time. When you lower the load, make sure you're counterbalancing to protect the spine on the way down as well. Our first anti-rotation exercise will be fairly simple, but we'll need a partner to utilize for resistance. We'll also revisit the bracing sequence and show how it can be utilized in a more functional way. Jesse will be the one working today, so what I'll get him to do is just show us what it's like to have your arms extended and feel resisted without tension through the core. So if I were to give him resistance from side to side, it's really easy to move him. Next, we're going to engage the bracing sequence and try that again, making it harder just by engaging more heavily through the abdominals. So root to the floor, pretend to rip them out apart with your feet, contract the glutes, contract the abs, rib cage and shoulders down, and align the neck by drawing the chin back slightly. Now, you know that I'm going to give you resistance from the side, so you're going to actively resist against it. So as I push, he's going to rely heavily on his deep abdominal muscles to stabilize against that rotation. So you can do this for time, breath, or reps, whatever is comfortable for you. Just make sure that you're conveying that with your partner. To make it more difficult, you can simply just engage more heavily and ask your partner to give more resistance. So I'm going to give him extra resistance now, and he's working very hard against it. It actually even turns into a bit of a workout for me to give him the resistance. To make it harder from there, or the furthest progression, would be to add resistance quickly without him knowing when or what side it's coming from. So he has to use a more dynamic contraction to resist against that rotation. So these are fairly easy exercises to use, and it really shows how important it is to have that engagement through the core, and also how simple training those muscles can be. In the next anti-rotation exercise, we'll perform a Pallof press. Today you'll need a band and a partner, but you can use the band and any anchor point to perform this on your own. The first progression that I'm going to show you is going to use your partner as the anchor point. So what he'll do is just hold the band with some tension. You'll take the band and bring it in close to your sternum, and then walk away so you feel tension. The band's trying to rotate you, and you're working hard against it to resist. We'll root to the floor and engage the bracing sequence. Make sure that you have engagement through the outside of your hip and your glutes, and a deep contraction through the abdominals. From the tension here, we can make it harder by extending out in front of us. With that lever lengthened, it's trying to pull you more aggressively to the side, and you're working hard against it. Make sure that your shoulders always stay back and down. And the last progression here can be a lift of the arms so that your lever is higher. Try to avoid bringing your shoulders up or bringing your arms back. We should still have the extension out to the front. We can do this for reps in a very controlled manner, or you can choose to add an isometric component where you hold a little bit longer for a certain amount of breaths or for a certain amount of time. To add your partner, we can both extend at the same time on my count, and this just challenges us to coordinate a little bit more. So we can adjust if we need any more tension, and on my cue, we'll do our extension at the same time, and then have the option of adding the extension overhead as well. 3, 2, 1, extend out. 3, 2, 1, extend up. 3, 2, 1, back to the middle. And 3, 2, 1, reset. One of my favorite quotes is from a strength and conditioning coach in the NHL named Matt Nickel. Simple things done savagely well. I find that this eloquently describes how I approach core training and believe most people should. improving the neuromuscular connection, and enhancing your stability, strength, and endurance in your core and postural muscles doesn't have to be fancy or complex. Utilizing simple exercises with proper form, body awareness, and the right amount of tension is all you need to make yourself resilient to injury and improve performance. Hopefully, the simple exercises and educational components I've provided you today will help you in your training journey.